Hi, this is Eric Durek, and welcome to this edition of Medhealthfit, the television show that integrates wellness and healthcare. This is our second season. We're very excited about our guests and our programming and our formatting. Everything's going great. And this edition, I'd like to welcome Dr. Craig Brandman. Craig is the CEO of a company in Palo Alto, California called Step One Health. And Craig, I met you last spring at a conference, a health and wellness conference in San Diego, and I was enthralled with your company. Tell us a little bit about what is Step One Health? What's the sort of the global reach of what you guys are wanting to do?
Step One Health is a company that we formed about 2 years ago. We've been building out our technology and our partnerships, and we're really focusing on providing the consumer who is ready to engage and feels personally empowered to take control of their wellness and their health. And so we have provided them with the opportunity to establish their own baselines, their personal numbers, and then to begin to understand what their options are to continue to maintain their wellness, or if they are finding through the establishment of these baselines that they have some issues that may in the future cause them to have disruptions in their wellness, to begin to address those risks as early as possible so that they can mitigate those risks in an optimized way.
Okay, when you say they're panels, we're actually talking, the basis of Step One Health is I'm using my blood panel analysis. I'm having a blood draw, and I'm using those numbers, those blood numbers, whether it's cholesterol or my fatty acids or my fasting blood sugar, whatever those numbers are, in order to sort of steer me in a direction in terms of my health issues. So am I correct in assuming that?
That's exactly right, Eric. I think that what I would add to that is that we have the convergence of what I would describe as 3 points of reference for the individual. We have the opportunity for them to answer some questions about their sense of how they're feeling, what their lifestyle is like today, where they see the direction that they want to take some of those lifestyle issues that they are currently enjoying. Then we are able to also establish certain baselines in terms of their laboratory numbers, like you referred to, so cholesterol, kidney function, liver function, their blood numbers, and we've also added the ability for them to get a report on their personal genomics. We think that those 3 things provide a very comprehensive baseline and a status report for the consumer so that they can really understand where they are today and where they can basically begin to go in the future.
Okay. I want to talk a little bit about genomics. I've been reading about it. There was an article in one of the Fortune magazine or one of the business magazines here recently about the whole element of genetic testing. And so when you say genomics, it's a branch of genetic testing. And basically what you're looking for is a piece of a person's genetic profile in order to, again, make another medical decision. So give me an example of a person's genomics that you would use in Step One Health to benefit them, to steer them in a direction.
Well, there are a number of opportunities, and really what we have discovered in the health arena is that genetic testing and profiling has become much more affordable in the last 2 years than it was previously.
Okay.
So it is now more accessible to the average individual. In some instances, health insurance will pay for it. In other instances, they don't. But because of the relationships that we've been able to develop, we can really provide access to this rather comprehensive personal information in a way that is very approachable for the average consumer. So some of the things that we are able to really learn about people there are elements of genomic testing that are referred to as pharmacogenomics.
Okay, pharmacogenomics.
And what that tells you is whether or not you are likely, because of your current state, to not deal well with taking certain very commonly prescribed medications. One of them is a medication called Plavix, which is very commonly prescribed for people that may have heart disease. It's a platelet inhibitor. Platelets can basically be a very active part of causing people to have heart attacks. And so in many instances, cardiologists will prescribe people with Plavix. In some instances, if you have the associated genetic marker for Plavix, you can be at risk to bleed to death.
Well, I was going to say, for our lay audience, Plavix is a type of blood thinner.
Exactly.
So it's almost like you could become a hemophiliac, right?
Well, you can actually bleed to death. Exactly.
Right. So the genomic aspect of your testing says patient A is going to be fine. We can give them Plavix. We don't see any interaction with other drugs, or we don't see really any interaction in terms of bleeding. Whatever these genomic elements are, they fit in really well with this drug Plavix, whereas other people, we got to stay away from it.
I think that's exactly right.
Well, and I told you that I have a relative back in the Midwest who's actually working for a company that's doing just the genomic, it's actually a pharmacogenetic company, and they're going out to the docs and they're saying, this is really the way you should prescribe medications now. And I thought it was kind of brilliant because from what I understand, most people who are having problems with medicine are having problems not because they were prescribed the wrong medication, but they were prescribed 2 or 3 medications that we don't really know what the interaction is. So your genomic portion answers those questions, right?
I think that's exactly right. That's very well said.
Okay, so that's because I always try to bring this, because I'm not a doctor. You are by training a physician, and my next question is going to be a little bit about your background. But as a physician, you probably have a better understanding of this than most people, and it's a very frustrating process. So when someone says, well, we're going to have you take this pharmacogenetics test, they're like, oh no, I might get an A, I might get an F. So but basically I want to explain to them, as the host of the show here, that this is going to steer you in a direction that this drug, it might be a perfectly fine drug, Plavix might be a great drug, but you can't take it because you've got this problem genetically, and you may have a bleeding problem. Okay, so that makes sense to them, so they'll move on to what the next thing is. So my next question to you is, you are by training a physician, and when I first met you, I was fascinated that you said back in the day that you were actually involved with, you were a heart surgeon, is that correct?
Well, I was an interventional cardiologist, which that specialty in medicine does not actually do heart surgery per se, but we do procedures on people. So we do coronary angiography, where we actually take pictures of the arteries that feed the heart muscle with blood, and we can determine whether or not there may be areas of blockage that need to either be addressed by a heart surgeon, or as part of my practice, we developed, cardiologists in general were in the mid-'80s developed something called angioplasty, where we actually insert a tube into the artery that has a balloon attached to it, and we expand the balloon, and it sort of moves the blockage out of the way. And it was a way to help people that had these blockages and forego having to go through a much more comprehensive procedure, which was open heart surgery.
Were you not part of one of the original groups that did stent procedures as well?
We did do stents. That was another way of basically maintaining these recently dilated arteries and keeping them from basically becoming clogged again.
And for the lay audience, again, the stent is something where you sort of insert into that catheter, and it's actually like a mesh, and it sort of keeps the lumen of that vessel sort of more open, so it's not going to clog, and it allows more blood to go through. So,
exactly.
Exactly. So great. So you have years of training in medicine, and in our we had a pretty lengthy discussion, I remember, down in San Diego, but in gleaning from what you were talking about, you're seeing this change in medicine. You're seeing a very large change in medicine. You're seeing 2 sets of tracks here, and that if medicine does not go down one, there could be a lot of issues. And you believe that Step 1 Health is going to be one of those types of companies, because it is an online company. It's something that I can log on to, step1health.com, and I can look to see about the blood panels. I can look to see about the health questionnaires and the surveys, all of these things that you do, and then you have health coaching and stuff. So I can put in the genomics, I can put all these pieces of the puzzle together, and I can sort of create this self-styled lifestyle enhancement program all through the internet. Where does the doctor fit in there?
Well, what we do is as you described, we give people the opportunity to learn these things about themselves so that they can learn where their opportunities are, where their options are, and we do it in collaboration with their doctor. So we don't displace the doctor. We allow people to basically become more informed about themselves. We think that you are the common denominator to your health,
right,
not your doctor, and you really are the one that is ultimately responsible for doing the things that you decide to do through through establishing your baselines and understanding what your options are. You're the one that's responsible for actually doing those things. And I think that most doctors know, and many of us know because we're human, that compliance with a plan is, our best intentions, sometimes we get in our own way. And so we may
You meaning the doctor?
No, I
Or
think, the individual, the consumer. I mean, all of us. So we know that we should exercise more. We should get out and we should walk for a half an hour every day. But we have busy professional lives, we have children, we have our friends that we want to go and spend time with. And so there are a lot of things that are competing for the things that we ought to do, and we may just be really sort of wiped out at the end of the day.
Right.
And we just may want to sit down and put the baseball game on and just sit there and veg out for a little while, and we go, well, I really know that I should get up and walk. And so what we know is that if you pick something that you really own, your likelihood of being compliant with that plan goes way up. And the more compliant you are with your plan, the more optimal your outcomes are going to be. And so whatever it is that you're doing, it doesn't matter. If you are really committed to doing it, you're probably going to get up in the middle of the baseball game and go, well, it's really nice, I'd love to watch this baseball game, but I really have to get up and walk.
Okay. Point well taken, because I know that even in my lifestyle, some days there's just long days, busy days, etc. But if I'm a person who has been referred to Step 1 Health, and I looked through it, and I thought, well, this is kind of interesting. Why would I want to choose that versus just staying with my doctor, or maybe talking with his dietitian or his health coach? Or what are the benefits of what Step 1 Health can do for any patient, any consumer, versus the traditional doctor-patient, dietitian-patient, in clinic or in hospital or in doctor's office relationship?
Well, that's a great question. What I would say is that what we are really focusing on doing and providing to people that see us as a resource is to make them more informed when they choose to interact with their doctor, so that they can be asking questions that they really want to know the answers to, because then they will get the opportunity to really make an informed choice about what it is that they're going to do, because there are many options to deal with a variety of medical problems or health or wellness problems. And so there's not just one answer. And so, there are instances, let's talk a little bit about people that have lipid issues. And this is another place where the genomics sort of come in, and this was a real sort of an aha moment for me, actually. In our country, because of the diets that we eat and because of, where we came from, we have a very high prevalence of people that have abnormalities in their lipids, and they are at risk of developing heart disease and other, having strokes and other pretty serious medical problems. Well, the choices are that you can change your diet and eat what we call a Mediterranean diet, where you de-emphasize red meats and butter and dairy products and focus more on eating vegetables and the like, and eating chicken and fish and those kinds of things. Or you can add exercise. That can frequently have a very big impact on your lipid abnormalities if you have that. Or if you don't choose to do any of those things, if you just say, listen, I just know that I really like my steak. I'm just not going to give that up.
I'm a steak.
then you can take medications. And there are a number of different choices for medications, but some people don't want to take medications. Well, what we've learned in our genomic education process at step one is that about 50% of the people in our country are never going to affect their lipids in a positive way by changing their diet. They just don't have, they have that genetic abnormality. So I can't tell you the number of people over the years who I said, you know, you've got this lipid abnormality, and you need to stop eating so much steak, and you need to knock out the butter and the cheese. And they would come back 6 months later and we'd check their lipids again and they were unchanged. If we had had the opportunity back then to look at their genomics, I could have said, you know, you can go on and keep eating the steak because you're never going to improve your lipids by doing that, but what you really need to do is you need to exercise, and depending on how well we do with your exercise program, we may need to have a conversation about taking some medications. And so what you do is you help people avoid doing something which is difficult, changing how they eat and their relationship with food, and being frustrated because they never got the outcome that they wanted. And so this gets back to what we talked about a minute ago in terms of compliance and optimizing outcomes. Because if you're doing something and it's not getting you where you want to go, what are we all going to do? We're going to quit doing it.
Right. That puts that whole genetic piece into perspective, because I remember I had a friend of mine who is a dietitian, and her mother had extremely high cholesterol levels, and she tried, I mean, you're going to be a vegetarian, you're going to be a vegan, you're going to be this, you're going to be, I mean, she completely changed this woman's eating patterns, and she still had very high cholesterols up until the day she died. And she was in her 80s when she passed away anyway, so I don't necessarily think that that was per se a hindrance to her. But maybe the aberrant change in her eating patterns and all these other kinds of things that she was not forced to do, but asked to do, you know, that might have been frustrating because you're making all these changes and you don't really see a difference in the blood panel.
Right.
And you're saying, well, oh, it must be me, I must be a bad person or something, when in reality, there's a percentage of people. And so one of the things I'm going to say is that, and I want to stay with the cholesterol issue, that someone may have a high lipid level, but one of the things that I'm reading about now in medicine is the concept of inflammation.
Right.
And that it might not be so much that your cholesterol is high, it may be the inflammation in your system which is causing the problems, that the heart condition, et cetera. Does Step 1 Health address that as well? Is that sort of part of the package?
Absolutely. We believe that inflammation is a very important part of what causes people to basically have interruptions in their wellness. And so we have partnered with a group called the Cleveland Heart Lab. They were an offshoot of the Cleveland Clinic, which has been a very famous place for people to go and get their heart-related issues dealt with. And they've come up with a panel of inflammatory markers, we would call them, that have a high degree of specificity to tell people that they have inflammatory issues and that they need to basically do mitigations for those inflammatory markers. And you know, the mitigation for the inflammatory markers can be, you know, again, lifestyle changes. We talked about that a minute ago. You know, one of the things that really we have learned is a big part of exacerbating people's inflammatory issues are, you know, their stress levels. You know, how well do they sleep? You know, and again, that's where exercise and lifestyle issues become a very sort of holistic part of how people approach maintaining their wellness. You know, historically, you know, for a very long time, and it's changing as doctors become more aware of the importance of these things. But you know, you'd go to your doctor and they would test you and they'd figure out something and you get a prescription for a medication. Well, you know, not everybody tolerates medications that way. It may make you feel a little crummy. It may make you feel a little tired. And now that we know that there are other choices for people to basically consider when they begin to address these issues, which can include, you know, how do they, you know, what's their life, you know, what do they do the hour before they go to sleep at night, you know, and a lot of people have television on, they get themselves sort of all spun up, And then when they turn the light out, it's sort of hard to fall asleep. And so for a lot of us, maybe it's better to sort of turn the television off before you're going to go to sleep and, just sort of take it easy, chat with your partner, about the day. Hopefully, your kids didn't make you crazy that day, and, just sort of relax and sort of get into a mindset where when you turn the light off, you can actually fall asleep and get a good night's sleep, because that's going to be an important part of reducing your stress level and knocking down your inflammatory markers and keeping you from having, an event in your life which is going to disrupt your health.
Right. It's interesting that the stress and the relaxation seem to be things that are moving more to the forefront. I remember when I was involved with medical research, there was a very, very interesting article in the early 1980s, I'm sure you're aware of it, where the author proposed the hypothesis that if everyone could just train for a marathon, we wouldn't have coronary artery disease. And that was the thinking back then. Just exercise more. By gosh, if you exercise, you run a marathon every day, you'll have the best coronary arteries, in the world. And now we're sort of moving away from that. You're exercising too much. You're, lifting too heavy weights. You're involved with CrossFit or martial arts or something. You're getting yourself beat up. Why don't you kind of step back here a little bit, relax, learn about Tai Chi, learn about breathing and meditation, learn about lowering your stress hormones, and you might be healthier. So I actually see that as a shift too, and I know that you guys work on that because we talked about the stress hormones as part of your panels as well, and I think that's just such a hugely important thing. The cortisol, the insulin, the epinephrine, the norepinephrine, all these types of things that people can look at and say, if you can just learn, control these things. That's why it's so important. That's why I think bloods are so important, is that people can understand. I mean, we've had cholesterol sort of beat into our consciousness for the last 30 years, but now we're looking at immune system panels, which I personally get. I want to know what my natural killer cells and all those things are. I'm also a big fan now of the stress profiles, because that's so important for people. So once they can understand how well the lab panel is almost like the foundation of where their journey goes, that's why I think your company is so important. So we have a few minutes left. I'm going to ask a couple more questions here. How expensive is it for me to do Step 1 Health as opposed to going to my doctor and getting we have a physician here in Santa Barbara. My personal doctor is James Quacco, so he has the Quacco panel, and it's immune system and omegas and all these types of things. I don't know how expensive per se it is because my insurance pays for it. But in speaking with you, you guys seem to have a little edge on the competition in terms of the value of what you give and the price points that you offer.
Well, and I think that the point that you made, Eric, is, I think, an important point, and that is that understanding your baseline is really just a starting point. And knowing, we talk about it in the context of knowing your numbers, knowing your personal numbers. Mm-hmm. Because what you then do is you then have the opportunity longitudinally to look at your numbers again, 6 months, a year, depending upon what you find out when you start, and you then create a baseline and a trend in terms of understanding what direction you're going in. Are your numbers getting better? Are they getting worse? Are they staying the same? Is what you're doing really accomplishing the goals that you want? So from a price point perspective, we really offer people an opportunity to get this information in not only a more cost-effective way, but also in a better time management way. So I'll give you an example. So let's say you're feeling great and you wake up and it's your 40th birthday and you decide, I better know my numbers. I'm not getting any younger. I feel pretty good. I get out and I exercise. I'm eating not as well as I should, but I'm paying attention. But I really want to know. Mm-hmm. And so you go into your doctor. Well, today, even with insurance, that's going to cost you $100. Right. And there's nothing wrong with you. You feel great. So you go into your doctor, and your doctor says, hi, Eric, how you doing? You go, well, I'm pretty good. I was just 40. I want to know my numbers.
And for me, that was a while ago. So
for all of us. I want to know my numbers, and the doc says, okay, great. How's your mom and them? And you have a little conversation. Right. And he gives you a order to go get your lab done, and you've now had to make an appointment to see your doctor. invariably you'll have to wait because
Yeah.
it's just a time. So you leave work, you got to go sit in the waiting room and you wait. It's probably a half a day by the time you just get all of that done.
Right.
It's cost you $100. Then you go and get your lab done. You have to wait a couple days for the results to get back, and then you got to go back and see your doctor. Another half a day, another
Right.
appointment, another $100, and he goes, "You're doing great. You look good. Keep, go with God."
Only cost me a day and a half of work. So
Right, and so with what we do, we allow people to go online, get some information about what tests are good to establish a baseline. We've got a baseline panel that we recommend to people. It costs about $50, maybe a little bit more, $60 for people to do that. They get their results back. They can choose to share those results with their doctor. They avoid the first half a day of being away from work to go in and get the lab result, the lab order. We are basically able to bill insurance if they have insurance. Most everybody is now going to have insurance because of the Affordable Care Act. And so we can bill insurance for that, or if for some reason or another these lab tests are underneath their deductible and they have to pay for them out of pocket, it's going to be less expensive than if they went to the lab that their doctor sent them to, just because of the price points we've negotiated. And so they've saved time, they've saved the cost of the first doctor visit, and then if they decide as a result of looking at their lab results that they want to go in and see their doctor will have had their lab results sent to them, and they can go in, they can have that conversation then. And so when they go in, they're having a more informed interaction because they've had a chance to look at their results, look at some of the information we give to people about, if this number's a little high or that number's a little low or whatever, and they can ask questions that are more specifically tailored to their personal issues, and that interaction with their doctor can therefore be much more meaningful. And so it just enhances the quality of the information gathering experience.
Okay, so I'm gonna put some things here in the last minute here. I'm gonna put some aspects in perspective. Step One Health is an online company. It's probably less expensive than the current model of a blood testing. You use that information along with genomic information to guide the patient to a desired lifestyle approach, whether it's changing in foods or exercise or stress reduction, etc. So unlike the doctor that may just give you the panel and say, "You're okay, go with God, my son," you actually give them more bits of information. So Step One Health is, when I mentioned at the beginning of the episode, lifestyle management. You're taking all of the lab and genomic and what we'll call that baseline medical data, and you're really trying to get these people to think of a different way of taking care of their own health. Now, we're going to continue the conversation in our next segment. But I want to thank you for, this is very, very enlightening stuff, and we're going to continue this in our next episode. But I'm going to sign off right now. I want to thank Dr. Craig Brandman for our first segment here on Medhealthfit, talking about his company, Step One Health, and we'll see you next time.